Please stop mom shaming. It is 2025. I mean, in the 1970s, it was like the peak of mom shaming, right? Don't nurse your child, you need to be formula feeding. Don't coddle your child, they need to learn to, cry it out in their bed, whatever. Like peak mom shaming. At this point, it's 2025. I feel like we should no longer be mom shaming. People just mother differently. And this happens all the time with fevers. I hear all the time, don't treat the fever. The fever is good. That's true. The fever is the body's way of killing off the virus or the bacteria. I get that. And when the fever is low, I don't treat the fever. I'm a pharmacist, so I'm okay with medicines, but I'm also a well-balanced diet kind of pharmacist, right? Like I don't need medicine for most things, but I'm gonna use it when I need it. For instance, you have a child with a fever of like 99, 100. I personally choose not to treat the fever. They're not miserable. They're just maybe a little fussy. I will do the cold compress socks, and I have this little onion paste mixture that I put on their chest, and that works. And then you can put cool compresses in their armpits and their groin, and that reduces the fever. But you know what the goal was? To reduce the fever. If the fever is high at like 103, 103.8, which frequently happens for my kids when they get fevers, I don't mess around. Like I'm going to get the acetaminophen and the ibuprofen from my medicine cabinet, and I'm going to treat that fever with the medicine because I want to make them feel better now. It is in my power as their mother to make them feel better. Instead of saying, oh, sorry, honey, I know you don't feel well, but your fever is really doing its job. And I know it's been 4 days of a fever of 103 and you feel awful, but I'm not going to do anything because I want your body to do something on its own. I don't feel comfortable. My mama heart can't handle that. It's one thing if I'm miserably laying on a couch with a fever and it's just awful and I choose not to treat it. But when my baby's laying on the couch with a fever, I don't feel good as a mom sitting there going, I know I can do something about this. I'm just not going to do anything about this. So it's okay to give medicine when your child needs medicine. And I'm just sick of the mom shaming. If you're a mom who wants to use the natural means, by all means, please do it. But if you're a mom who turns to the acetaminophen and the ibuprofen in the cabinet, I'm all for it. The end goal is the same, to make your child feel better and to reduce the fever, no matter how you do it, the natural means or the medicinal means. Your goal is still to reduce the fever. So please, it's 2025. Please stop mom shaming.